Welcome to MedGate today, sir. Happy Independence.
Happy Independence Day, really.
Okay, sir, on the event of Independence Day, I would like you to ask, from treatment to prevention, can India build a healthier nation by 2047? What's your vision?
So definitely it is possible. If we have that vision, we can build a healthier nation by 2047, definitely. So first, I think we should focus on prevention. And prevention of disease or cancer or any health problem, it first has to reflect in our lifestyle, our dietary patterns. So I think we will have to focus on a healthier dietary pattern. And so we have to avoid obesity as much as possible, avoid a sedentary lifestyle, exercise, completely give up on alcohol. Alcohol should not be consumed, and it will, we will never be able to reach our goals if we keep consuming alcohol. Yeah. And also we have to stop using tobacco and tobacco products, smoking. It has to completely be
What about the e-cigarettes, vape?
That also is nearly equally bad, so I would not recommend that also. So preventing obesity, having exercising, preventing a sedentary lifestyle, avoiding red meat consumption, and having adequate amount of fiber, salads in our diet, having a balanced diet, having adequate protein deficit is a common problem in India, and we have to really take care of that. And we have to make sure that our women, our children, our everybody consumes adequate protein in their diet. So, apart from these few factors which can actually really make a big difference in preventing disease, including cancer, diabetes, cardiovascular disease, or metabolic diseases, what else we can do is the screening of common cancers and vaccination. So, Government of India has done really brilliantly well by introducing the human papillomavirus vaccine for all. In the national immunization program, and that will really take care of the cervical cancer.
So what about the NCDs, non-communicable diseases?
So, non-communicable diseases, by that you mean cardiovascular and diabetes, hypertension, all these diseases. So as I told you that having a good lifestyle will really make a big difference in preventing all these non-communicable diseases and cancers also. So apart from prevention and screening, we should talk of cervical cancer screening at generally at a marriageable age. We do pap smear and screening for HPV. That should be a part of the screening modalities. Other screening tools which have really are important is the mammogram, which is generally done beyond 45 years of age, generally at frequent intervals, and beyond 50, colonoscopy and fecal occult blood testing. This is indicated. And if you have symptoms of urinary symptom obstruction, then prostate-specific antigen is one test which is commonly done, and a digital rectal examination which is done by generally a doctor. So all these can actually at least lower the burden of certain common cancers. Avoiding tobacco can actually take care of many of the tobacco-associated cancer, including lung cancer and oral cancers. For lung cancer, also screening modalities like low-dose CT chest for those who are high risk, who have a very significant history of smoking, they generally would benefit from such an approach. So I've spoken of prevention and screening, and now coming to the treatment, how we can make the treatment better. We have to do indigenous research. No substitute for doing India-specific, India-centric research. So the government of India and all the doctors and the healthcare teams, industry, pharmaceutical companies, they have to come together and they have to do research in India so we can actually make treatment accessible to more and more people in our country. Because right now what we are doing is most of the treatment we are importing.
Yes, sir.
There is nearly very little indigenous research, although there is some progress now being made. But I would say we need to do a lot more research in India to actually get to that goal of better treatment and prevention in 2047.
Yes, sir. So that are the things that we should keep in mind for a healthier India and a stronger India.
Absolutely.
Thank you so much for joining us, sir.
Thank you.